Hello and welcome to Fresh Perspectives. My name is Gail, and my guest today is a lady that you've seen on Doc Hamill's show from time to time, talking about the Children's Safety Village, because she is the executive director, and her name is Jessica Dayton. But that's not why she's here today. She's here today because I've been wanting to do a program on CPR training, and those initials mean cardiopulmonary resuscitation.
Correct.
Yeah. I brought that up in case people didn't know, but with the baby on the table, maybe they were figuring out that we were going to do something like that. And I wanted to because when I worked for the Resource Center, we were trained in cardiopulmonary resuscitation, and we had to take a refresher course every year. And one day, not too long ago, a couple months ago maybe, we're listening to National Public Radio, and they're talking about CPR training, and they're talking about, we used to have to give breaths and chest compressions both when I was trained. And I'm hearing them talk, oh, they're doing just the chest compressions now. But I suppose somebody could do breaths if you had two people available that were trained.
You actually are still able to do breaths, but in the very least, especially since COVID, or if people aren't able or comfortable to give breaths, the compressions are most important.
More important than the breaths.
But
Okay.
doing both increases the effectiveness.
Okay.
So they still recommend it, and if you take a certification training in CPR, we still do breaths because it just improves the chances even more. So in the very least, hands-only compressions absolutely do benefit, and they're very important. But if you can combine both, that gives that person the best chance of survival.
Oh yeah, I know. Another part of the reason I wanted to do a program on this is, I want to encourage more people to learn CPR is the reason I wanted to do this, because, if somebody is is not breathing and their heart isn't beating, well, sometimes people don't make it anyway, even if they do get CPR, but there probably are a certain percentage of cases where people would survive if there was somebody there at the time that had been trained in CPR.
Sure. Yeah.
So I thought it would probably be a really good idea. Now, how long have you been an instructor?
I have taught CPR since 2014. So
okay,
next year will be 10 years.
10 years in another year. Yeah. Okay. And what is the training like to become an instructor? Is it a little more, is there more to it than just regular CPR training to be an instructor? Yes,
so we have to become certified as well. So we do have to take the regular, it's a basic life support class, which is CPR certification's the basic certification, then there's CPR and first aid and basic life support above that. And healthcare professionals tend to have the basic life support, but and also like EMTs and things like that. So I had to be trained in basic life support, and then there is American Heart Association has an instructor's essentials course that you have to take, and when you align with a training center that is accepting new instructors, you have to go through a training with them and be observed teaching before you're allowed to teach on your own.
Before you're allowed to teach on your own.
Yep.
And if some people just don't seem to be really cut out for teaching, they don't get to become an instructor then?
When the training center supervisors are observing you, they're observing to make sure that you can teach the skills clearly in a way that people can understand them, that you are able to present that information correctly. So I guess that would just depend on what the situation is and if people are okay standing up in front of groups and doing that kind of thing.
I was just thinking a certain amount of people get stage fright.
Sure.
So
yeah, it's not for everyone.
teaching a class might not be too easy for them. Okay. Let's see. Now, is the Heimlich maneuver part of CPR training? Because when we took it at the Resource Center, they included the Heimlich maneuver for choking victims.
It is.
So they included that as part of it. We had to take first aid training and all that too, but I remember now, I have not actually ever had I have been lucky in that I have not ever actually had to do chest compressions before. However, I have had to do the Heimlich maneuver on people.
Which is more common, you know.
Yeah,
choking is very common.
Yeah, and it really works too.
It does.
I mean, you do it right and whatever they're choking on comes right out. So we could cover that a little bit today too, because we will be demonstrating some things. But I think if somebody passes out because they're choking from a lack of oxygen, their muscles all relax. Am I remembering that right? And is it easier to...
It can be. I think it depends on the situation and what it is they're choking on. And every situation's a little different.
I know.
But yes, if they pass out or their heart stops beating, you would go into CPR. And you can still give breaths even if they have an object lodged, because that actually might help dislodge the object. The only difference is that after you give the chest compressions, which can also dislodge the object, you look in the mouth to see if you can see the item that they were choking on, because then you can kind of roll them onto their side and help them get it out.
That's what you do, is roll them over onto their side?
Yeah, I mean, if you have an object towards the back of the throat that has come up, that you can see, bringing them to their side's just going to let gravity help the situation. They don't want you giving a blind finger sweep, so that means if you're choking and somebody's laying down or just even upright and you see the object in the back of the throat, do not put a finger in and try to get it out if it's way back in the throat, because what they found obviously is that it pushes the item back down in the throat. And that defeats the purpose of what you're trying to do. So you would repeat the process, or you would try to get them on their side to see if the object came to the front of the mouth where you could take it out rather easily.
Well, I had an experience with a dog one time that was gagging on something. It was when I was pet sitting for some neighbors of ours one time when they were away on a week-long vacation, and one of their dogs had been chewing on a stick, and there was a piece of wood, well, about that big around and about that long, sitting way in the back of the dog's mouth, right above the throat. And I knew that it probably was not a good idea for me to reach inside that dog's mouth and try to pull it out. I mean, the dog could breathe, but she was gagging, you know, and I knew that had to come out of there. So what do? I put her in the car and make an emergency trip to the veterinarian's office with the dog. I called them ahead of time to let them know I was coming, so when they saw me arriving, they called me to come in a different door from where the other patients come in. And it was a good thing I didn't try to do it myself. It took both me and the veterinarian's wife to hold the dog to keep her still, and then the veterinarian went in with what looked, I think, was a stainless steel tool that was slightly hooked at the end. And when we got her to where she was calmed down, he just reached in there with that tool and snatched it right out of the dog's mouth, but if I had tried to get it out myself, I probably would have poked it down the dog's throat.
Yeah.
So, I mean, that's not a human example, but it could happen with humans too.
Definitely,
So
yeah.
I kind of like to inject those little stories into my interviews sometimes. Let's see. Do you show videos of CPR training being done? Because when they would always show us videos when we took CPR training. Do you use those also?
So they, American Heart Association uses both video and instructor-based information, so you can demonstrate. You can also, they'll show the chest cavity and the heart, and so you can see how it's pumping in a graphic, like a picture graphic, of, an animated graphic.
Yeah, so it shows like what's going on with the internal organs while you are.
So it gives you a better visual and understanding of what it is you're doing when you're giving compressions and even giving breaths, and what the heart is possibly doing inside the person's body. So we do use video scenarios. They show the full scenario, of somebody actually having an emergency or a heart attack, something like that, where they would need CPR. And then everybody gets to practice on mannequins and things like that, so that they can refine their skills, really get a feel for how to do it correctly, and it's kind of a tested, approved way that does both for kind of all learners, so you get the video, the audio learning, as well as the practice.
Yeah, I remember having to practice on the mannequins, and my mouth is just small enough that I had trouble doing breaths on the mannequins. So I was having a little difficulty. No, you've got to, cover the whole mouth and everything. But they did say something about on a real human, because it's not hard like a mannequin, that it's actually easier to do.
It is.
But eventually the Resource Center got these things to put over the mouth and the nose of the people that had a bulb that you would squeeze to do breaths instead of mouth to mouth. Do you do anything with that in your training?
We do. For our basic life support classes, we use the bag mask, and it has a bag attached to the face mask to deliver air. Most people don't have those. They're primarily used by medical professionals, just because that's part of the supplies that they have at their disposal. But they do have pocket masks too, without the bag. But a pocket mask is it kind of folds in, and it can be purchased. Anyone can purchase one, and it's in a case, and you can take it out of the case and kind of pop it out, so that it's a full-size mask. And you can use that, and that's something that can be in a first aid kit, or you can carry with you a little bit easier, where you'd still be giving your own breaths, but you'd be giving it into the mask. And not mouth to mouth.
Does that help protect you, like if somebody has COVID or something and you're giving mouth to mouth?
And just because you wouldn't be having any facial contact with that person.
Oh, okay.
And then they do have also barriers that you can purchase. They even come on little keychains. You open them up, and it's just a kind of a barrier with either a one-way valve or a lining that the air can get through, but no bacteria or germs can. So they've really come a long way in providing options for people to still give breaths without having to touch the person's mouth. If that's something that, if they didn't know that person, if that person was sick, they were uncomfortable, those are options you could use that for.
I can remember one of the times that I took CPR training, this one instructor was saying that sometimes the person vomits, and this was back in the days before all of this stuff, and before COVID, years ago, and he was saying sometimes they'll vomit and you'll get some of it in your mouth, you know, but they were explaining all this stuff to us then. But so it was kind of it was interesting, though. I mean, I was glad to take it. You know, I think it's nice if you can save somebody's life.
Absolutely, yeah.
Now, for the breaths, there's another thing which you'll probably, when we get that far, you'll probably be demonstrating. And there was a certain way to tilt the head to keep the airway open when you're giving breath, and
yes.
You'll be showing how to do that.
Yep.
So where do you teach CPR?
We teach CPR at the Chautauqua Safety Village, and we also go out into the community. So we will bring our mannequins and all of our supplies, and we will come to businesses or groups of people, schools, anybody that asks us to come in. And we have different tiers of CPR. So we have what we call Friends and Family CPR, where it's learning the skills. It doesn't include a 2-year certification. And I mention that because a lot of employers require 2-year certification for their jobs. So we get a lot of people that do need that to meet their requirements for work. But we'll even go into the high schools and middle schools, and we'll teach family and friends CPR. I was at Jamestown High School earlier this week teaching just the friends and family, which is, you know, they get to practice, they get to learn, they get to do all of those things, but it's not a course that you have to be tested to ensure that you can accurately complete the skills. So
you teach this to like high school students?
We do, yep. We go into the high schools, we'll bring the mannequins, and we will teach them both hands-only CPR, AED, and breaths as well, and the Heimlich.
Do you feel that elementary school children are too young to learn it?
I don't think they're too young. American Heart Association won't certify anybody under the age of 12, just for the sheer ability of being able to do it. We do teach hands-only CPR in our 4th grade first aid lessons, because if they can start young, learning those skills, even even for friends. Now, an 8-year-old or a 10-year-old giving CPR in an adult is probably not going to be effective.
Probably not, because the child will be small.
Correct.
Yeah.
However, if that 8 or 10-year-old has a younger brother or sister who's 3 or 5, and they know how to give a compression, there's no saying that wouldn't be effective. But even just planting that seed at that age of this is what you do and how you do it, they can build from that as they grow. So we do think it's important for them to, even at a very basic level, start to learn those skills.
Now, there's something else that I remember learning when I worked for the Resource Center, and that is something about having a person laying on their left side in certain types of situations. I'm trying to remember what those situations would be, if it's when they're in shock or injured or something. Can't really remember exactly, but there was something about having a patient laying on their left side because it was restful, because the heart is not in the very center of the chest, it's more over to the left, that it's supposed to be restful for the heart to be laying on a person's left side.
If you're giving chest compressions, that's you would have to have them flat.
Right, right.
But if that's not needed, say they had a stroke or they might be vomiting, those are all the reasons they call it the recovery position, because it's a little less stress on some of the organs. Even if you have digestive issues, at night they say laying on your left side prevents the acidity acidic juices in your stomach from coming back up.
Yeah, I've read that. I've read about that.
So
yes,
if anybody's struggling with that at night, laying on the left side is supposed to be an improvement for that. When you lay on your right, there's more of a chance that it comes back up, like the acidic juices and things like that.
Yeah, I read that somewhere recently that if a person suffers from heartburn at night, they should lay on their left side. So I know some people have to have the head of their bed raised on account of that. So do you ever do anything with maybe you don't for CPR training, but you probably never counsel people on eating a better diet or anything?
No, we don't as part of the CPR training or any,
because you're just
we're there
you're
to teach
just
the
training
skills.
for emergency situations,
Right.
basically.
Right. And teaching people how to respond to those emergencies.
Yeah, okay, so something can get started right away. Okay, well, you are going to do some demonstrating for us. You have a baby laying on the table.
Yes.
And are you going to demonstrate both CPR and choking procedures on the baby? So I'll let you take over with that.
So we'll start with the baby. So if you need to give CPR to anyone, adults, infants, or children, it's always going to be 30 compressions to 2 breaths, especially if you're by yourself. If you have another person with you, you could do 15 to 2, but we certify in the CPR training with always 30 to 2. So that means 30 chest compressions to 2 breaths.
Okay, do you do the 2 breaths at the same time that you take the break from the compressions?
Yes.
Okay.
And so I am going to demonstrate both the compressions and breaths, and then people can also know that if they're not comfortable giving breaths or they don't have a barrier device or something like that, they don't have to give breaths. But because it increases the chance of survival, I am going to demonstrate it. If it's a loved one, a family member that you're not afraid of doing that with, definitely to give the breaths.
Okay. One question, does it happen very often with an infant that the heart may stop beating and the child may stop breathing? I mean, is that an experience that you know of, any situations of?
It's not as common as in adults. Chances are, if the infant has a heart issue, they would have found that at birth upon delivery when they have all of the testing that they do.
So they would probably know then if there was some heart condition.
Correct.
Okay.
And then they would help address that or provide the parents with assistance at that point. So the likelihood that the parent wouldn't know as an infant that there was a heart condition that maybe they were born with is probably slim, just because of those tests that they run when you first have the baby. And SIDS, it is the sudden infant death syndrome that can occur. It's not as common either, but it is a reason you'd have to give CPR to an infant. But when you do give CPR to anyone, you want to make sure they are on a hard, flat surface, because say you were in bed and somebody, your husband or your partner, spouse, or child needed CPR, and if you give those compressions while they're still on the bed, the compressions won't affect the chest.
So you have to move the person to the floor.
Correct.
Okay.
Otherwise, the mattress will be what goes down instead of the chest.
Okay.
So you always want to make sure that you're on a firm, flat surface that doesn't have any give to it. And so that way the compressions will get through that chest cavity to the heart.
Okay.
So 30 compressions to 2 breaths for infants. If there is a situation, whenever you come upon a situation for all ages where you need to give possible CPR, you're going to approach the person, but you're going to check the scene and make sure it's safe for you to help. If there, was a dangerous situation that occurred that created the emergency.
Like electrocution?
Right. You want to make sure that you don't put yourself in that danger as well. So you want to make sure, first and foremost, that you protect yourself so that you are also not in the same situation. And if the scene is safe to help, then you're going to approach the person and you're going to try to wake them up. For infants, they suggest tapping on the foot and trying to wake the infant up, just because it's a very sensitive part of the body.
Okay.
And you can, try to wake them up and baby, are you okay? And try to, really get them to rouse. If that's not working, you can check for breathing. So you can put a hand on the chest. You can bring your head down to listen to see if you can hear any breaths coming from the nose or the mouth, and see if you can feel any chest rise or fall. Okay. In basic CPR, you do not need to check for a pulse. In like the basic life support training I mentioned, you do check for pulses in those. But American Heart Association believes, and I agree, it's better to give CPR even if you're not sure the person needs it, than to not give it and have them need it, right? So if you start giving compressions to someone and they wake up, your purpose is complete, right? You were able to give compressions, or maybe they fainted and you just had a hard time getting feeling for waking them up, rousing them, and getting a feeling for their breathing. So it's better to do it, because if the person doesn't need it, they'll wake up from those chest compressions, right? So they don't want you wasting too much time in assessment. They want you to check for the breathing. They want you to try to wake that person up, and if that doesn't work, you're going to go right into compressions.
Yeah, I remember being trained to feel, is it the carotid artery that you would feel on the side of the neck? But you don't necessarily do that anymore. Then.
Right, and it's really because they want to minimize the time that a lay person doesn't have medical training uses to assess the person before helping, and then also because if you don't know exactly where to look for a pulse, it can be hard to find, especially if that heart pulse is shallow. And so people were taking a lot of time trying to find the pulse, which is time that you could be using helping this person. So unless you have additional training on how to check for a pulse, they suggest you just jump right in after checking for breathing and trying to wake the person up.
Now there's something about measuring where the rib cage comes together. What do they call that thing you're supposed to make sure not to press in on? You're supposed to measure up a hand or something from that?
They don't. Maybe that could be an older way of teaching, but what they want you to do now is to bare the chest, so you can see the chest, and you find that nipple line, and you'll see the divot in the chest that everyone has. If you feel your own chest right now, you'll feel that divot right where the sternum is, and that's right where you want to compress. And so,
do you compress between the nipples? Or?
Yes.
Okay.
And so for infants, in which they classify infants through American Heart Association as anyone under the age of 1 or small enough, you don't use full hands because the infant is too small for that. And I'm just going to stand because it's a little easier to demonstrate. But when you give compressions for an infant, you are actually going to take 2 fingers, and you're going to find that sternum, the divot right in the chest, and take 2 fingers and compress, okay? And for an infant, they want you to compress 1.5 inches deep.
1.5 inches?
Yes.
Okay.
So it'll be 1.5 inches deep, and you'll do 30 compressions. So first and foremost, after making sure that the scene is safe, you've checked the victim, they are not responding, you've checked for breathing, you can't find any breath, then you're going to yell for someone to help to get 911 immediately, okay? And then you'll start helping that person. And our mannequin trainers here actually have a light system on them, which is great. They started in 2019. having feedback devices so we know how to give a correct compression. And right now it's blinking red because I'm not giving CPR, but once I start giving the CPR, you'll see 2 big green lights pop up.
Oh, okay.
And that means I'm going deep enough and I'm going fast enough, because you want to compress at about 100 to 120 beats per minute. If you've heard the song Staying Alive, you can sing from the Bee Gees, you can sing that in your head. You can sing Baby Shark if you've ever heard that song, but let's not sing it now because you'll have it in your head all day.
Yeah, let's not do that.
But you would actually, after assessing the patient and calling for help, you would start giving 30 compressions. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, you're going to tilt that head back to move the tongue out of the way. And with infants, because their mouth and nose are so close together, you're going to give your 2 breaths covering both the mouth and the nose.
Okay.
So I've tilted the head back. I'm going to place my mouth over the mouth and the nose of the infant and give 2 short breaths. And you can see the chest rise as you're giving those breaths. If for some reason you don't see that chest rise, you let the head reset back to normal because maybe the tongue didn't move out of the way, and you try it again, okay? And you would keep giving these compressions, 30 compressions to 2 breaths until help arrives, as long as you can. Now, if your fingers right here get tired from doing the compressions this way, you can switch hands. You can also now use your thumbs.
Oh,
okay.
Okay.
So you can use you can kind of encircle the baby's body and use thumbs right in that same space. Okay. The only thing we suggest is don't move the infant. You move yourself. So some people's natural thought is to pick the infant up and
turn them around.
To make it easier. But we suggest you change your body and keep the infant still.
You might cause more problems if you move the infant.
Correct. Yep.
Okay.
And so you're going to count to that 30, and then you're going to tilt the head, which lifts the chin, and breath. Okay. With infants, you don't need to give super long breaths because they have small lungs. And I think a lot of times it's common for people to want to try to give long breaths to make sure enough air gets in there. But just 2 short breaths. If you see that chest rise, then you know that you did your job. And you would keep on going like that until help arrives. Okay?
Okay. Okay. Now, there's another piece of advice that's usually given out, and if you are the person performing CPR on somebody else and you become exhausted, then what do you do?
If there's somebody else that's there that can help you, you want to switch out. It is tiring, especially for a CPR on adults, and that is because it takes more effort. This is something that you can switch hands and do a little easier, but especially for adults, if you can switch out every 2 minutes, because you give 30 compressions to 2 breaths, and you in that 2 minutes you can give 5 sets of CPR. So that could be 150 compressions in 2 minutes. So if there's somebody there, have them help and switch on and off, so you each can take a rest.
Because they say that sometimes if you're getting exhausted and you keep doing it, then there might be 2 victims instead of just 1.
It's possible. And you'll not also be giving effective CPR any longer.
Okay.
When you get tired, you're not going to be able to give as much exertion or effort, and then your compressions aren't going to be as effective.
Okay. Would you like to demonstrate now on the baby what to do if the baby is choking?
Sure. Obviously, babies like to put things in their mouth, so this could be quite common. And a lot of times people think that when someone's choking, they can make a little bit of noise, but really if something's lodged in that throat, they will not be able to make sound, right? Their airway is blocked, they're not able to breathe, and they're not able to actually speak and make sound. With infants, some telltale signs is that they will start to turn blue. Their fingertips will start first, their lips will start to turn blue, they're not making any noise. And so for choking, the Heimlich on infants is different than children and adults. And you want to make sure you're seated. So I will kind of come over here just so you can see it a little easier. And with an infant especially, you want to make sure that their head is supported. So if you can support the head, because you'll be flipping the baby over, right? So they're going to be facing down, then they're going to face up. So I always say to be able to support the neck, to hold on to their cheeks right here, right? And keep that airway open. So you can almost make a C with your hand and support the baby's neck through the cheeks. And then you're going to lay the infant down your arm. Okay, so now their whole body is supported. And that's why it's great to sit down, because then you can rest your arm on your leg. And you want to make sure that the baby's facing downward, because if the baby's facing downward, gravity will help the situation. You're going to then take the heel of your hand and give 5 back slaps, okay, right on the center of the back of the baby.
Between the shoulder blades?
Between the shoulder blades. Okay. So you're going to hit 1, 2, 3, 4, 5. And I know that feels like it goes against everything we know
about not abusing children,
not hurting children. But the alternative is, if you don't get this object out, they will not make it, right?
Right, right.
So it is life or death. If they have an injury as a result, they'll heal from that. Same with infant CPR. Anyone will heal from an injury, so it's best to give it and save their life. You can't heal from that, right?
No, you can't heal from choking to death.
Right.
No.
So after you do your 5 back slaps, you're then going to support the head, the back of the head, and you're going to flip the baby over to your other arm. And you're going to take 2 fingers, just like you did for the chest compressions, and you're going to compress 5 times, okay? And then you're going to actually look for the object, so you can kind of lift the baby.
See if it's come up.
Yep, and you can see if the object's there. Again, if it's in the back of the throat, you want to repeat this process so that it comes out further into the mouth, which makes it easy to grab, because we do not want to do that blind finger sweep. You might have to do this a few times. A lot of times with the gravity and the back slaps, the object will come shooting out. But when it does, make sure that you hear that baby breathe. Because what can happen is they might actually put more than one piece in their mouth. And
there might still be some in there.
Right, and I say that because actually one of my very good friends had a son at about a year old, a year and a half, who had shoved a lot of small chopped watermelon, just very small pieces, but had put many in his mouth and started choking on that. So when that object first came out, they did the Heimlich. And it worked. This object came flying out, but they still didn't hear anybody crying. He wasn't making any noise, and they realized there was more, and there was actually 3 pieces stuck in his mouth. But they were able to clear them all using the Heimlich. So it's always really important to note, you make sure you can hear that person gasp for breath, breathe, cry, anything, and if not, there might be something more in there.
Okay, yeah, that's good. Well, I guess it's time to move down to the floor. I'm going to stand up to watch.
Okay. Okay, so CPR for adults and children is a little bit different. And the reason I include both children and adults is because it's still going to be that 30 compressions to 2 breaths, but you could possibly use 1 hand for a child. So if this child was 8 years old or under, hasn't gone through puberty yet, they consider that anybody between the ages of 1 and puberty as a child. And if you're looking at a 4-year-old child, they might not need 2 full hands. So you can use 1 hand like this for a child, but if that doesn't work and you don't feel like you're getting a deep enough compression, you can go back to 2 hands. And that's the only difference between CPR in adults and children. So again, we're going to make sure the scene is safe. You're going to come up to the person, you're going to ask them if they're okay, try to wake them up. Hey, are you okay? Are you okay? They're not responding, so I'm going to listen to see if I can hear or or feel any breathing, then I can't. So I'm going to ask you to call for help. Call 911 and get an AED if you have one. And then we're going to do 30 compressions.
An AED, is that the mask?
Then an AED is an automatic external defibrillator, and I have one here, and we're going to show you how to use that too, because so many people are scared of AEDs because they deliver electric shock, but it's actually a CPR person's best friend. If you have to give CPR, this will turn it on. We'll show you how it works. And they're being carried now in grocery stores.
Oh, are they?
And you know, schools.
Oh, you mean they sell them in grocery stores?
Nope. So
or they keep them there in case of an emergency in the store. Okay.
Correct. Yes, they keep them there. Especially like schools with, they have usually one at the nurse's office, things like that. So it's really important because it provides an extra benefit and likelihood somebody will survive that CPR. So if there's one available, you can ask somebody to call 911 and get an AED if it's available, and then you're going to start in chest compressions. Again, we want to bare the chest and see that nipple line. We're going to put this time the heel of our hand right in that divot, right where that sternum is, right here in this divot area. We're in kind of parallel with the nipple line.
Yeah, they used to teach us something about doing both hands.
Yes.
Do you kind of interlace the fingers or something?
Yep. And so you're going to take this hand and put the heel of the hand in the divot, and then you'll put your other hand on top like this. But when you give CPR, do not lean back, okay? You actually want to come up and over this person so your body weight can help. If I'm trying to give CPR from back here, then it's actually going to be my arm muscles that are doing the work, okay? And if I'm back here and I'm trying to press down, I can't get down deep enough.
So you actually need to use the upper part of your body.
So you do, yes.
Yeah.
So by coming up and over, do you see how the chest is already compressing just a little bit from my body weight? You're going to actually, you're going to use your body weight to help you compress down. You also want to make sure your elbows are locked in place. If my elbows are out bent, again, I have to use my arm strength. But the easiest way to administer CPR is up and over this person and have your elbows locked, and you use your body weight to count to 30 to press down. And for adults and children, it is 2 inches that you want to press down. So I will show you the 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Then I'm going to tilt the head back just like we did for the infant. I'm going to squeeze to close the nose and squeeze the nose shut. And I'm going to cover my mouth with their mouth. I'm going to cover their mouth with my mouth and give 2 breaths. And again, you can see that chest rise. If the chest doesn't rise, you let the head reset and you do it again, okay? So you're using the whole upper part of your body to press down. And you're going to keep doing these compressions until help arrives or until someone brings an AED. So the AED, you would actually, they all look different. This is a trainer, so it's not a real one, but they all look very different, and they all work the same. Some AEDs you might need to turn on. If the lid is closed, you open it up. If it doesn't turn on its own, you're going to turn it on. If it does turn on, it'll just start telling you what to do every step of the way. Okay?
Oh, wow, that's handy.
So it is your little best friend. People are nervous about it because of it, it being able to deliver a shock, but it really does provide extra support. And you'll notice that there's 2 kinds of there's 2 sets of pads here, or a set of pads, but they have 2 pictures. They have a picture of adult and a picture of a child. And so you can use these pads on adults or children. And a lot of times pads will also there will be extra pads up here in the top of the case. And you would plug in the pad that is the right size. It'll say child pad or it'll say adult pad, okay? If it doesn't, you can use adult pads on a child, but you see the way that they show you in the picture, okay, and you follow that way. And just kind of show that there. So I'm going to place the pads since this is an adult. I will place the pads just like it shows. But if you're using it on a child, there's a child button you can press because that will deliver less shock.
Okay.
Because the children don't need as much. So it's going to start talking, and I'm just going to follow the directions so you can see what happens. Okay.
They run on batteries then?
They do.
Okay.
Yeah. They run on batteries, and I believe they're lithium batteries that last quite a long time.
Oh, lithium batteries?
The real ones, yep.
Okay.
Okay, so let's see.
Adult patient. If the patient is a child, press the child button. Press pads firmly on skin.
I'm actually just applying the pads right as it shows me in the pictures.
Do not touch the patient. Analyzing.
While it analyzes, you do not touch the person.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
You want to make sure you audibly say, everyone clear. Make sure no one else is touching this person. Then you're going to press the red shock button.
Shock delivered. Begin CPR.
And then you do your compressions. And do you hear the metronome? It just counts with you.
20. 30. Give 2 breaths.
And you keep going on like that. So it will just keep showing you what to do. And it keeps track for you, so you don't lose your spot. It tells you when to give breaths. It's really a huge asset to have one of these. And then every once in a while, it'll ask you to stop touching the person so it can analyze again to see if they need another shock. Okay. A couple things to note about the AED is if the person's chest is wet, take something just really quick and dry it off. Okay.
Oh, okay. Does sweat count as
you know, it'll still stick, but if there's a lot of sweat, it's just nice just to wipe it off, just to make sure those pads stick. Other things you have to consider is pacemakers. If somebody has a pacemaker, you'd still use the pads, just don't put the pads directly on the pacemaker. Okay, you'll be able to see the pacemaker because it's raised, so you can tell that it's there. You place the pad to the side of the pacemaker. Okay.
Okay.
And then if that person's chest is extremely hairy and the pads won't stick, a lot of AEDs include a razor, and you can give a dry shave really, really fast.
Oh, just shave the hair off.
Just shave the hair where you're going to put it. And then if all else fails and you have no razor and there's an extra set of pads, you can put the set of pads on that you're not using and rip them off to try to get that hair off.
Oh, really?
Yes.
Oh,
yes. So there's numerous options. If that doesn't wake this person up, you know they really needed it.
I'm glad I asked you to come on Fresh Perspectives because there's all this new stuff now that I didn't know about before.
And it's really important for the AEDs that you make sure no one's touching that person because that can cause a first aid emergency if somebody else is touching that person.
How does it cause the first aid emergency?
So if somebody, I just want to make sure that I don't, here we go, okay. I didn't want to remove the mic. If somebody is touching the person that has the AED, that's using the AED, the electric shock will go straight through that victim into the next person that's touching it. Okay. So electricity travels, and it'll travel right through into the next person. So if somebody is touching the patient's feet, when the shock is delivered, that electricity will go, it'll shock this person's heart, go straight through into the next person that's touching. Okay.
Will it cause that person, the second person, to have a medical emergency?
It could, yes.
And does it cause any damage to the person that the CPR is being done on if another person is touching?
It doesn't cause any, I mean, I think the electricity would still travel through this person right where those pads are.
Where it was supposed to be.
Yes, but then after that travels right into the next person. And you don't know, I know there's people that have done that where they've you know, been in trouble afterwards. And medically, you just want to make sure nobody is touching that person so you can deliver a safe shock. And that goes for you too. Never put the AED across from the person where you'd have to reach over that person's body. You always want to keep the AED on the same side as you are.
Oh, okay.
So there's no reaching over.
Okay.
As far as the Heimlich maneuver for adults and for children, we do so differently than we do with the infants. We want to make sure that you're about the same height as the person. So if I have a child who is like this tall, I'm going to kneel down and I'm going to get to the correct height for this person. If I have a tall person, I'm going to ask them to kneel down.
Oh, okay.
So one of you would be kneeling if you're not. Now, if I had to give you the Heimlich,
we're approximately very similar in height. Yeah.
Right. So we wouldn't have to kneel. But it's really important to note that, you know, we've asked questions when have been teaching classes, and we ask what you think that people should do, and a lot of people's answer is to get a chair and stand on the chair. And if that person falls back and you're on a chair, then again, it's not keeping yourself safe. So the result could end up in a first aid emergency. So the best thing to do is kneel.
I would have to ask my husband to kneel down because he's 6'8".
Oh yes, you would. You certainly would. Yep. And so the next thing there is once you're at the correct height, if you're standing, you want to put 1 foot forward. And I say that because it helps stabilize you. If the Heimlich does not get this object out and that person passes out from lack of oxygen, you're going to need to help them to the floor gently. And if you're standing just like this, 2 feet together, you're not stable. And if that person falls back onto you, you'll fall back too. So having 1 foot forward is nice because that helps you stabilize and can accept that person's weight a little bit better. Then you're going to, and you probably can't see it on the TV, but there's a small divot here.
Your belly button.
That is indicative of the belly button, yes.
Right.
And so if you see that small divot, this is what I'm using as the belly button. But you want to find that person's belly button, and you want to put your fist right above the belly button, okay? And you're going to take your other hand and you're going to go over top of that, and then you are going to go in and up, in and up, in and up. And you have to do so pretty hard, okay? Is with as much might as you can, because you're trying to expel the air that is trapped in this person's body outward to help get this object out, okay?
Yeah. I know, but then their muscles relax. You have to do it on the floor then if the person passes out.
That's correct.
Put them down on the floor.
If they pass out, you can do it on the floor. If the person's pregnant, you can't go right above the belly button, so you can actually go right up on the chest.
Do chest compressions,
yes.
Sort of?
Okay. You can, if the person, if it's, say, a child trying to get their arms around an adult and they can't get their arms around the adult, they can lay down. You can lay them down and you can give the Heimlich from a horizontal position, and you can give them chest compressions. Either way, those chest compressions are going to help expel that object, okay?
Are you supposed to be able to do the Heimlich maneuver on yourself if you're choking to death? Yes,
you are, and that's a great question. So the Heimlich...
Because sometimes people are alone when they start choking. So,
right,
yeah.
And this has been a proven way of helping yourself. But if you, kind of move this way, there we go. If you are alone and you are choking, you can take the back of a chair about this height, a corner of a table, if you have a corner, you know, a rectangular table, and you can, right above where the belly button is, you can actually throw yourself
onto
with
the back of
force
the chair.
on that chair, okay? So I'm not going to actually throw myself with enough force that you see it, but just as a demonstration, right here I'm hitting right above that belly button where I need to be. And you need to give it as much might as you can. So it would cause, I'm sure, nausea and vomiting for some, which would surely happen if I tried that for real right now. But you want to actually force it.
Yeah, okay.
Through the back of a chair, the edge
at
of a
the
table.
at the same spot that you would if you were performing it on somebody else.
Correct.
Okay.
Yes. Yep. And it actually does work. There have been people that have used it on themselves before and survived, to tell the tale.
Good.
So
good.
it is effective. But you have to do it hard. And I'm sure panic would start to set in, but you need to keep going as hard as you can until that object comes out.
Okay.
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 So it's kind of a quick rundown of a variety of different things, but it's better to give it, and even if you're not positive that they need it. So that way they have the greatest chance of survival.
Mm-hmm. Now I wanted to ask another question. You were demonstrating the Heimlich maneuver on the baby. Are you supposed to do it that way up through a certain age? Can up through a few years or so?
It depends on the size of the person. If they're petite, that would still work. If once you're not able to do it, actually support the child or the infant. An infant is, through the American Heart Association's guidelines, are considered anybody under the age of 1. But if you have a petite 1-year-old, you might be able to still hold that infant or child and do it this way.
Mainly because it would be too difficult
to actually hold them, their weight, and everything like that. And that's, and so you can use your best judgment. If one way doesn't work, because they're on that cusp, you're like, let me try it this way, and you don't feel like it's doing anything, you can try the other way. But back slaps are always going to work, too. They're, so even those firm back slaps, they really help.
Okay. We're almost finished, so I want you to tell the viewing audience where they can get CPR training and how they can contact you or another instructor if they want to take CPR training.
Sure. So
which they should.
It's a benefit for everyone to know.
Yeah.
The Chautauqua Safety Village holds one CPR class a month.
Wow, that's good.
Yes, because we also have other classes that we teach. We figure one a month seems to be a good amount for us. Our website, chautauquasafetyvillage.com, has the CPR information, the different types of CPR we offer, as well as our class schedule. And we do offer both in-person classes, the full 4 hours in person, or 2 hours depending on the class, or there's, since COVID, a hybrid option, where you can purchase a course online through the American Heart Association, and the link is on our website. And then after that, you can come to a blended session where all the videos are done, and when you come to us, it's all practice and testing from there. So that's where you get your skills.
And there's a phone number and a website and all that you can tell them about?
Yep. Our phone number is 716-338-0170, or chautauquasafetyvillage.com. And we have myself and another instructor that do the regular classes. Okay.
Well, thank you so much for coming on Fresh Perspectives today and sharing this really important information with us. And I'll see those of you in the viewing audience on the next episode.